most common way to check the pulse is their femoral artery, which is right on the inside of the thigh, which is really, really easy to feel in the dog. So you just put your 2 fingers right in there, and you'll feel that pulsing. Oh yeah. So it's actually right here. And it's really easy to feel unless you have a really obese dog, which I'm sure close enough you can actually see it. Yeah, you can actually see it. And then when you want to palpate the heart rate, if they're kind of lying in a natural position, like a simulated standing position, the point of the elbow, where that elbow touches the chest, is where you're going to be able to feel that point of maximum intensity. So that's where you're going to get your heart rate. And that's also where you're going to put your stethoscope. If you have a stethoscope and you want to hear, you put your stethoscope right there. And it's much easier to hear on the left side than it is on the right side. Yes?
When you use a stethoscope, what's the difference between the bell and the flat portion?
We don't tend to, you use the bell portion to auscult.
I don't use
like,
that portion.
We don't use, I'm not sure what that's.
Those are for human medicine and pediatric patients. We use a smaller size to be able to listen to pediatric patient versus the larger for the adult.
Well, we have stethoscopes. We'll use the small flat, but we don't use the bell. I don't even.
The bell's supposed to be for higher range, like usually breath sounds, like you can hear a little bit better, but for dogs it tends to be, we hear what we need to.
I thought the equine vets use that to like, you know, auscult gut
well, so you
sounds
can,
or
like you
something
can hear
like
different sounds, like a different range versus the bell versus the diaphragm, but it doesn't really make a difference for what we need to hear in the dog.
Yeah. So we just use the one sound.
Simplicity.
Well, you can also have stethoscopes that, depending on how far you press, like the pressure can create a bell versus a diaphragm. So if you just have one flat side, you can control without having to flip back and forth. So that's why I like the just one-sided one. It's easier.
Good. So when you're ausculting with a stethoscope, that's where you would put your stethoscope to listen to the heart sounds. Now the lungs are much higher up in the chest, so you're going to.
So you notice my bell side is just completely trashed.
So you're going to put it right here to listen to the heart, and then you're going to put it up higher to listen to the lungs, because the lungs sit really high in the dog's chest. And you can listen by quadrant, and their lung sounds tend to be really subtle and difficult to hear. So when you're ausculting the lungs, you're looking for really harsh or abnormal sounds, crackles and wheezes and things like that. And like Cindy described before, am I yelling? You can, if you're hearing a lot of noise, respiratory noise, you can listen also up in the neck area, and if the noise is really strong in the neck area, that's probably what you're hearing down here. Could be referred sounds from moisture in the upper airway. Maybe they're panting and stuff like that. So, any questions?
Do you want to go through the nose to tail
Exam?
Mm-hmm.
All right, so like Cindy was discussing earlier, I'm just going to do like a full physical exam. You want to have a systematic approach that you use every time so that you don't miss anything. It's easy to get distracted by this bleeding wound over here and totally miss something subtle if you're not doing your systematic approach every single time. So everybody kind of has their own way. Hi, you're so good. Hi, yes, your kisses. So I usually start with an assessment of hydration, and a couple of things that I do. I look at the eyes, and you want to make sure they look nice and moist. They're not sunken in. And then we do what's called the skin Turgor test, where you pull up the loose skin on the back of the neck, or even on the top of the head, and it should snap back really fast in a normal hydrated dog. And then if they're dehydrated, it will either stay up when they're really dehydrated, and that's really dangerous dehydration, or it'll go down really slowly. And then lift up the lip. And you want your mucous membranes to be nice and pink and really moist. And then this is also a good opportunity to look at all the teeth, and you're looking for missing or broken teeth. Hi, good girl. And we can do our capillary refill time. And this is where we push on the gums to blanch them out and they turn white, and then you count the number of seconds where they return to the nice pink color, and normal is between 1 and 2 seconds. And then we look at the nose for symmetry, we look at the eyes for symmetry, we lift up the ears, you can smell them. Sometimes if they have discharge or early signs of a ear infection, which is common in dogs that have ears like this, it'll smell yeasty, and that's a sign of an ear infection. Good girl. And I won't show you how to auscult, but I feel the whole entire body. Make sure everything feels symmetrical, there's no lumps or bumps. Push the fur back, make sure I don't see any skin lesions, things like that. Lift up the tail, make sure everything looks really normal. Looking for any signs of maybe discharge back here. And then we go to like a musculoskeletal exam and putting all the joints through their range of motion, looking for any signs of pain or decreased range of motion, things like that. Also, again, palpating the abdomen, right behind the ribs. Just push your hands up, and it should be nice and soft. You should be able to kind of feel little organs kind of flopping around in there. She's got some nice abs, so you can feel her abdominal muscles really nicely. So. And there shouldn't be any splinting or wincing. Sometimes if they're painful, they'll turn around and look at you. Sometimes when they're really painful, they might turn around and try to bite you. But she's of course really very normal. So, all right.
So one thing that I like in my exam, and I think we're going to let other people, add a little bit of nuances too. The big thing is to stand back before you even start your exam. And this is something you're kind of processing anyway, and looking at the big picture. And so, especially with my students, when I'm trying to, teach them, they're always running in and trying to get close. But you learn so much from just standing back and looking and listening to the dog. You can appreciate their behavior, their stance. How many people can hear her breathing? So you don't. So a normal dog, you don't actually hear the breathing. But if you walk in to an area and you hear a dog like, that's going to tell you that there's a problem or it's a bulldog. So, there's definitely some stuff before, because what happens is as soon as we touch the dog, all our scope gets very close in, and we might actually miss some things that are more obvious from a distance. So taking an assessment of their behavior, their stance, their general.
It's hard not to.
And the other thing is, when I do examine a dog, if it's not your own dog, introducing yourself to the dog before you start grabbing. Again, this is with the veterinary students. They're often very eager to put their hands on and practice things, but actually having a little conversation, if your, proctologist came up and just like started the exam without introducing themselves, it might be a little rude, and it's sort of the same thing here. Jen, did you have any other comments or thoughts that, in your exam, especially because Jen's doing a lot of rehab stuff, so her perspective on something.
Orthopedics, feeling for any swelling. The other thing is just looking for weight bearing, both in a stand and a sit, and see if they are offloading any legs, which can be signs of a settle, so that they should be square and bearing weight evenly. Sit. And then when they sit, they're normally like, that's a sloppy sit. But they should, be sitting fairly correct. If they're popping a leg out, or that could indicate some discomfort or injury that they're compensating for. So, and when they stop or sit, if they've got one foot out or the other. this foot's just kind of put on the ground, but obviously not bearing most of the weight. Those can be signs of some orthopedic issues, whether it's just muscle strain or you've got a partial cruciate tear. So those things. And just feeling for any swellings around the flow, the range of motion, type of stuff. So, and then whoever gets hurt, or she has an abnormality on her physical exam.
Any other comments that you guys want to put in as far as your exams?
I would add, like I see a lot of shepherds, so like a tail jack for lumbosacral disease, just so that you know how comfortable a normal dog is to have their tail bent and how flexible it is, and then when you start to see changes,
What she
happens
needs to
because of it.
So some breeds, like shepherds in particular, have disease of the lumbosacral
area here.
region, and those dogs will exhibit pain when the tail is lifted.
Christy, Cheryl, do you have any comments you want to add?
Maybe perhaps some proprioception.
Sure, why don't we, because we talked a little bit about proprioception, and I've demonstrated with my personal body, but I think that let's demonstrate it with her.
All right. So checking for conscious proprioception is done. You want them in a comfortable, normal standing position, and then you support their body slightly. You gently turn over and place their foot onto the ground, and they should automatically flip it. And it should happen really quickly. It should just snap, which is kind of a neat thing. They just don't want to stand that way, so it just really. So dogs with some sort of neurological deficit or spinal abnormality or something like that will either just leave it there and just stand like that, or they'll kind of sort of warble and then slowly flip it back. So those are signs that there's something neurologic probably going on. So, and then you do it with front legs too. It's a little bit harder on the table. And you want to place it. Normal dogs usually don't let you. And then you know, oh, they're probably fine.
I mean, and that's a really good point, is if the dog's completely normal in their gait, their posture, their stance, a lot of some of the more subtle things you're not going to need to worry so much about. But once you start to get any abnormality, that's when you really want to go into a lot of the detail and try and pinpoint what that underlying problem is.